Hi, my name is Craig Miller. I have been a licensed health and life insurance agent for over 10 years and have personally sold healthcare policies in all 50 states. I have at one time or another been appointed and certified with all the major health carriers in the United States. I would just like to take a few minutes of your time to personally introduce you to a new long-term healthcare plan that could potentially save you thousands of dollars in healthcare costs over the traditional ACA plans. If you are currently under 64 years old and in good health, you could qualify for this plan. It's a PPO-based plan with a nationwide network of doctors and hospitals.
Before I give you more information about this unique plan, let's talk about the Affordable Care Act or ACA plans. By the way, these plans are also called Obamacare or Marketplace plans. A lot of people don't realize these are all the same plans, which I agree can be confusing. Okay, let's talk about the pros and cons of Obamacare. The pros are they accept everyone, regardless of your current health or any pre-existing conditions that you might have. You may qualify for a subsidy based on your income level that varies from state to state. And the plans are available in every state. So if you have current health problems or if you want to check and see if you can qualify for a subsidy, by all means go to www.healthcare.gov for more information. Here are the cons: high premiums and or high deductibles. If you have been on Obamacare for the last few years, you already know how unaffordable these plans can be. The high deductibles are especially troubling because you have to pay them off before you start receiving any benefits for things like doctor office visits or prescriptions or any other medical care. Most of them are HMO or health maintenance organization based with small networks. No one likes it when their favorite doctor or hospital is not in the network, and the network usually doesn't extend beyond their city or state. Many times you are forced to take a plan you don't like to keep your doctor or hospital, and vice versa. Sometimes your doctor's in the network, but the specialist that you need is not, so you can't use them. Also, please remember if you go out of the network, you will have no coverage at all. Next, the benefits vary greatly between plans. It's no secret that some plans offer much better benefits than others, so you better do a lot of research before picking the best plan for you and your family. You must apply during an enrollment period. The standard enrollment period has always been November 1st through December 15th. The Biden administration decided to extend the enrollment period from February 15th to May 15th in 2021. Before I talk about my exciting new health plan, I'd like to give you a small piece of advice as an experienced agent by talking about the ministry and short-term plans for a minute. The pros are they have very low monthly or weekly premiums, which is great, except they're not real insurance. The cons are they have limited insurance regulation protection. The ministry plans are not required to pay claims at all. The short-term plans were designed for 3 months coverage, and they put policyholders at great financial risk. Please, folks, don't fall for the super low premium trap and buy one of these plans. If these companies decide not to pay a major claim, your only recourse is to file a lawsuit against them. They already have thousands of pending lawsuits, so what do you think your chance of getting any money is? It's a sad fact that over 900,000 bankruptcies each year are caused by medical bills. Please don't be one of these people. Now let's talk about just one of the long-term plans I'm recommending you take a look at. It's called Premier Choice by US Health, which is a private company owned by United Healthcare. Here are some of the pros and cons of this plan. The pros are they have generally lower premiums and deductibles than the ACA plans. These plans will split the deductibles into separate parts. There's no deductible for office visits, lab work, preventative medicine, or things like that. There's a $500 deductible for accidents and a variable deductible for major medical conditions. Just this difference in deductibles alone could save you thousands on your healthcare costs. They have more overall benefits with available dental and vision plans. You can choose your own health and wellness, disease and sickness, and accident plans to best suit your needs. They have nationwide coverage in and out of network. So if you have a second home in another state or like to travel, you will always be covered with the largest network in the country. They have convenient teledoc phone appointments. You simply call a doctor on the phone and they can diagnose your condition, and if appropriate, they can call in a prescription for you no matter where you're located. They have no enrollment periods. You can apply at any time during the year. The cons are you must be healthy to qualify. This is only a con if you're not healthy. It is a plus if you are healthy, because if you can qualify, you can join a plan that is more affordable with richer benefits because your dollars don't have to pay for all the sick people like they do with Obamacare. It's not available in all states, and it's only available up to 64 years old. You must apply through a licensed company agent. And of course, that's me, a licensed company agent. And I would love to have a chance to talk to you for just a few minutes about your health care and potentially save you hundreds, if not thousands of dollars in health care costs.
By the way, I promise to never share your information with one of those terrible telemarketing companies. And if you ever do find yourself in one of those awful phone lists of non-stop calls, the only way to get removed from that list is to use the phrase, "put me on your do not call list." That is the only legal way to get removed from that list. So thanks for watching, and I look forward to personally talking with you soon. Have a great day and stay healthy.